want to give an overview on. First of all, Ash and Fresh were commissioned by the Department of Health and Social Care to produce some resources for local tobacco partnerships to support those as a part of a broader piece of work to support the implementation of the tobacco control plan for England. You may well have attended the workshops. There were 5 workshops that were held throughout October to February, and that has really helped to inform and give us a picture of the current state and how you are feeling towards that. And so those who have taken part in that, thank you very much for that. I also think it was really good to find out the the partnership approach to tobacco control. As we know, this is really important to our work and the opportunities that it creates around different routes and engaging smokers and the consistency of our message across our areas. The feedback from the workshop, along with the task and finish group recommendations, which Lisa will be taking us through later on, will then inform a creation of the resource and look to publish that later in the year, probably around November, early December time. So without further ado, I think that we're going to go to our first speaker of the day, and that is Vicky Salt, who is the Policy Manager at Action on Smoking and Health, ASH, and is going to talk to us today around some of the key findings from the regional workshops that I've just talked about.
Hi everyone. As Scott's just said, I'm going to talk through some of the key findings from the workshops, and again, many thanks to everyone who participated in those. So the workshops were focused along 4 key themes for tobacco partnership working, and they were strategy and vision, collaboration, infrastructure and communications, and we had some sort of key messages and key questions on each of those themes, and we felt that they were sort of the key pillars of partnership working and also would be really important in kind of bringing partners together on to focus on local tobacco control. So I'm just going to run through those, and then as Scott said, there will be an opportunity to ask questions or for further information, and hopefully you'll have received the overview of the workshops that was sent round along with the invitation to the webinar. So to kick off with strategy and vision, our key questions were whether your local authority has a strategy for tobacco control and whether that's linked to a sort of action plan, whether that's a kind of action-focused document that will take you through your kind of immediate sort of work. And the answer to this was quite varied. We found that some local authorities had a vision but not a plan, or a plan but not a vision, and there was sort of quite a lot of variation in the form that these documents and these proposals sort of took. But the really key message that was coming out of these was that having overarching strategy and vision was really helpful in bringing partners together and getting them signed up to that sort of collaborative kind of focused sort of idea of where you want tobacco control to go in your locality, what prevalence reduction you want to hit, what your kind of local targets are. And that was usually a sort of multi-year strategy. I think they actually varied between 3 and 10 years. And that in places, as I say, was supported by a sort of action plan, which was renewed more regularly and was the kind of really focused document to drive kind of the general work of the public health team and also of an alliance if one was in place. Also really important, and something that is going to be picked up on in the case studies, is about reporting to senior leadership and having their sort of involvement. It was talked about quite a lot, that having that senior leadership reviewing strategies and action plans and monitoring those performance indicators was not only really important for monitoring success of sort of activity, but it was actually really important for engaging those senior stakeholders, especially where there was sort of a good news story to tell, where prevalence had gone down, or particularly around sort of young people and declines in prevalence due to local activity. It was a really good way of engaging senior stakeholders in saying, if they were reviewing your activity and it was positive, it was a great way to get them involved and talking about and leading more kind of tobacco-focused work. So the kind of key message from us from this one was that it was really important both to have a strategy and a plan, that overarching vision for how you want to go about and what you want to achieve in tobacco control, and then that action plan that's gonna get you there. So our next sort of key theme was around collaboration, and obviously in terms of partnership working, this is a really important element for all local authorities. So our sort of key question here is what value comes from collaborative working on tobacco, and I think we were pleased to see that everybody throughout the workshop said that collaborating with partners was really important, that it sort of increased capacity and helped raise the profile of tobacco. So that's what we've got in our sort of key messages there. Linking to the first slide around that senior leadership sort of buy-in, people also reported having senior stakeholders was a key driver of collaboration. It enabled them to reach not only into sort of other partners external to the council, but also into other areas of council work, enabling, an approach from the chair of the Health and Wellbeing Board, say, was a really good way to get colleagues in other council departments on board and listening to and engaging with the tobacco agenda. The benefits of collaborative working were kind of, I think it's fair to say, many and varied, and I'm not going to kind of run through the full list of them here, but I think there were some sort of key elements that it would be kind of useful to draw out. So promoting consistent messaging through a broad range of stakeholders was a really important one, and obviously we know for something like e-cigarettes or other topics that there are a range of potentially sort of information coming through from sort of a range of stakeholders. We want everyone giving the same message and promoting that consistent approach. The other thing that was really important was around in providing a forum for structured engagement with district councils. So collaboration, and formal collaboration in particular, was seen as a really important way of engaging those key partners in districts and getting tobacco control on their sort of radars and on their agendas where previously it could be more difficult. We had a really interesting discussion in a couple of areas about collaboration on different footprints. So obviously we know there's a lot of work going on at the moment around broadening tobacco control work from local authorities out and putting it on the agendas of STPs and ICSs, and bringing together those broader senior stakeholders and making sure they've got tobacco on their agendas. And we actually had one authority telling us how they are working at an STP footprint for their alliance. So all of their alliance work is happening at that STP level, and they felt that enabled them to engage more senior stakeholders, and they found it to be reducing sort of duplication of work between different people in the local area. So a really interesting sort of example there where we found a new alliance model. And in addition, we found quite a lot of people talking about how they collaborate on specific issues. So even in areas where they didn't have that sort of formal alliance or formal tobacco partnership, we had people telling us how they have sort of specific collaboration partnerships on issues such as smoking and pregnancy. And again, working at not just the local authority, but also an STP or ICS sort of level on that specific issue and getting it onto those agendas and action plans and performance monitoring sort of frameworks for that broader kind of ICS STP footprint. So lots to think about there in terms of collaboration and how we're going to kind of move forwards with this kind of changing landscape and collaborate with new and different partners to keep tobacco on the agenda and also raise the profile of tobacco control. So our third sort of theme was infrastructure, and this was a really nuts and bolts sort of issue around how partners are going about their collaboration and what's happening in terms of alliances, whether local authorities have an alliance, and how that engagement is sustained if an alliance is in place. And also on the flip side, and if an alliance isn't in place, how that collaboration is happening and whether it's ad hoc or whether it's formalised in sort of different groups. So again, you'll notice a theme with our sort of key messages that senior leadership can be key to an alliance success, and it was something that we found really came out throughout the whole of the 5 workshops, was around that sort of vital role of senior stakeholders enabling not only kind of bringing on board different partners, but also keeping those messages high on council agendas and enabling alliances where they were in place to continue, or supporting sort of the revitalising of alliance activity where it might have dropped off the agenda. So this was again a very detailed sort of area for discussion, and we found quite some variety in whether local areas had a sort of ongoing tobacco alliance kind of model. We found just over 20 of the authorities that we spoke to did have what they called sort of an alliance that met regularly, normally either twice a year or each quarter. And there was a real kind of optimism in those areas around how they've been keeping that alliance live and how they've been keeping partners kind of engaged. There was a lot of discussion around how we kind of give partners ownership and their own sort of actions to take forwards to ensure their continued engagement in alliances. Quite a lot of discussion about making partners present at alliance meetings, so they have to turn up and have to engage in discussion. There was also quite a lot of talk about areas that are revitalising their alliance work and their tobacco control. Often we know, how difficult it has been with competing priorities and cuts to budgets to keep kind of partners coming to these meetings, keep them involved in something that might seem less central to their work. And I know this is going to be picked up in our case study, so I'm not going to say too much about that now, but one thing that really came through was actually the role of clear peer assessments in bringing stakeholders together and making everybody kind of sit up and listen and engage with the tobacco control agenda again. So I will leave that one there and let Kerry pick that up in our case studies. And then finally, I think one area that we really felt there was more work and more scope in was communications. So obviously we know comms is a really important area for tobacco control, for motivating quit attempts, for giving people the best chance of quitting successfully. And there was a lot that we talked about in terms of the absence of mass media campaigns and keeping tobacco sort of on communications agendas. We talked quite a lot about how communicating sort of tobacco control messages happens. So we divided this into kind of internal, external stakeholders, and also then communicating with the public. And there were some really interesting ideas around how communicating with the public can be facilitated through those partners that you have on an alliance or in these kind of ad hoc partnerships. So the police were a really interesting one that a number of areas talked about in terms of having a really broad reach into the local public. So finding lots of people follow the local police on Facebook or on Twitter, and that actually they're a really effective way of getting messages out about illicit tobacco campaigns or sort of other tobacco control activities happening locally. So our sort of key messages here fell into kind of different groups. We found that with a few exceptions, activity was mostly limited to amplifying national campaigns, and those exceptions were really the areas where we've had a sort of regional approach. So Scott in Yorkshire and Humber with the Breathe 2025 activity in keeping mass media campaigns on that regional footprint was a really kind of great example of how in the areas where we have regional activity, that's really facilitated the communications work. Likewise, in areas where there was a regional footprint previously and there isn't anymore, there was a real kind of absence of that. There was quite a lot of discussion about how kind of the previous regional work had facilitated the comms activity that localities now felt was hampered through not having that sort of capacity and that ability to work together with a sort of regional brand and identity that was well recognised and well used. So as I say, a few exceptions, but generally we found that activity was limited to amplifying national campaigns, and looking forwards, we know those national campaigns are increasingly sort of under threat from budget cuts. So we really want to kind of focus on this area as somewhere where we want to support localities to do more and to engage more with partners on a local and on a regional level, and a lot of areas reported that they felt more could be done through their alliance infrastructure and through their partnerships. Only one locality that we spoke to talked of having a tobacco control comms strategy. So a lot talked about sort of having a calendar or inputting into their comms team's calendar, but only one talked about having that sort of strategic kind of element as well. So an area where we're going to focus a bit more as we go through the resource creation, and you can think about as we move on through the webinar. So last thing from me is just some things to think about as we go through the rest of the presentations, and some thoughts to take away from today. So firstly, what is your vision for tobacco control? We asked this question throughout the workshops, and so those of you who participated in those will hopefully have thought about or have an answer to that. And for those of you that weren't able to join a workshop, this can be a question for you to take away and think about. And the second part of that as to whether your vision is prevalence reduction, we would really support all local authorities to be raising that bar and thinking about driving down prevalence, not just among those people attending their stop smoking service, but also all those smokers in their local area. So number 2 is making the most of the opportunities to build momentum around tobacco control and sort of making the case for tobacco. And this is not just in local areas where sort of there's an alliance and there's a structure through which you can go about doing this, but also in those areas where whether alliance activity has dropped off or how we can revitalise that and take it forward. So sort of making the case for continued investment, for continued prioritising, and what support you guys need locally to be able to enable you to do that. Thirdly was the levers for engaging partners. We all know people are more likely to do things if we can get it onto their agendas as well. So how can we communicate the benefits of tobacco control in language and in terms that supports engagement from our NHS and other partners? And finally, sort of, could you work with partners at a supra-local level? So that's the STP and ICS footprints we were talking about. And how do you engage with comms colleagues? And as I say, I think these are all things to think about as we move on through the case studies, and hopefully people will talk about these things as we move forwards. So I think that's everything from me. I'll hand on to Scott. again now.
Thank you, Vicky. That was a really helpful overview of those workshops. We're now going to hear some case studies illustrating the different examples of partnership working across the country. First of all, we've got Zaheera from Leicestershire County Council, and she's going to be talking about how to engage those district councils within that county council. Now, Zaheera's got to sign off a little bit earlier, so we're going to take questions after Zaheera's presentation. So again, please, if you've got those questions, send them through, and then we'll have opportunity to send further questions through as we hear the rest of the panelists. Zaheera, over to you.
Hi everybody, thank you Scott, and thank you Ash for having me on today to share our experiences in engaging partners here in Leicestershire. As Scott said, I am Zaheera. I'm the Stop Smoking Service Manager and Tobacco Control Lead for Quit Ready Stop Smoking Service that sits within Public Health and is part of Leicestershire County Council. So just a little bit of background in terms of our council. Within Leicestershire, we have around 690,000 residents, and around 90,000 of those are smokers. We are an upper tier local authority, and within the local authority, we have 7 district councils, all ranging in terms of smoking prevalence, some with very high smoking prevalence, others not so much. So it's a very varied sort of tobacco control, smoking prevalence within the districts. Okay, so the challenges sort of that we faced here, like most stop smoking services, there's been a lot of change over the years, moving from NHS into then local authorities, some going out, well, county, our service used to be part of a private provider commissioned by Public Health and was then brought in to be a provider service as part of Public Health. So this basically took place, the service came in-house on the 3rd of January 2017. And within that sort of time, there were a lot of restructures within Public Health, part of cost-saving exercises and that kind of thing. But not only that, the stop smoking service model had changed. We are primarily a digital-focused model with primarily telephone support, and that in itself brought about a little bit of anxiety for partners and that kind of thing. But we all know we're working with shrinking budgets here at Leicestershire. I'm working on a third of a budget that we used to have. We've got smaller teams these days with less resources, but we obviously still expected to meet the stretch targets, and that goes sort of without saying, but it's how do we do that innovatively? And we can't do that alone. We know that it needs to be a multi-pronged approach, and we need to look at pooling resources. I also dealt with a lot of fragmented relationships and lack of communication. It's fair to say, having a private provider previously, the partners were not feeling as engaged as they should have been, I suppose. So it was, how do we rebuild all of this? How do we build and on these sort of strained relationships? So I had my work cut out for me, needless to say. So I knew the key partners that we needed, and who we currently have sat around the table were district council health leads. We also have the Leicestershire Rutland Sport physical activity partners who all sit within district councils. We've got trading standards, Leicestershire Fire and Rescue Service, public health consultant with the tobacco control portfolio, and I've recently just extended an invitation to our neighbour council, Leicester City Council, to join the Tobacco Control Alliance. We've got similar agendas, so it just makes sense to do that. Part of the alliance as well, we just in the process of setting sort of subgroup meetings, and this is to include housing and tenancy associations, because we moving ahead with the smoke-free homes agenda, and those would be sort of feeder groups into the Tobacco Control Alliance. So those are the key partners that I identified to begin with. These are the people that are part of our Tobacco Control Alliance as we speak. So in terms of taking action, I suppose for me, I felt coming on board, it was almost like being a salesperson. Like I said, it was starting from scratch, and it was, looking at how we're going to go forward with this. And it's really about what I needed to do was not only gain the trust and support from our sort of partners, but it was also making it relevant to them. And I suppose the first thing I did was listening to them and setting sort of informal meetings, looking at what had been done in the past, and what our local priorities are and how we're going to move that forward. So it was very much doing sort of a pros and cons list. But I think what was really helpful, and I know Vicky's mentioned that earlier, in terms of the levers for engaging partners, one of the things I found really useful was the Ready Reckoner, for example. It gave district councils a local flavour, or what their tobacco control needs were in the area, and how are we going to move forward with that. So that was really useful. I also put out some stakeholder events. So once I gained their support, and we aligned our responsibilities and priorities and so on and so forth, I hosted 2 stakeholder events, one for mental health and one for smoking, pregnancy and maternal obesity, because these were sort of seen as priority areas. But it was giving ownership and responsibility to the health leads in terms of facilitating workshops, in terms of collaborating at this event, and giving them that sort of responsibility, and then taking away the recommendations from these events, and then how taking it to their local sort of populations, and how are they going to put those recommendations into use, what are they going to do differently with those recommendations, and then feeding that back to the alliance. We also do, there's lots of marketing engagement with health leads. A lot of them don't have a comms budget, so to speak. I do. So one of the things we sort of said was, right, okay, since I have a comms budget, I'm going to include them in this. And so whenever there's any new promo to be done, or there's national campaigns, I make sure that each district council gets a Marcoms pack, and then they can use that to help their local communities and to promote whatever it is we think needs promoting. So it's again pooling of resources there. We've also got trading standards. We fund for an enforcement officer, and they sit within the alliance, and they are contract managed by public health, so they do have to provide reports in terms of what the activity that they've been doing and any raids, etc. And they also come into our meetings and alliance to present on this as well. Then they have also put down meetings co-attendance. So just as important as I think it's for health leads and partners to attend our alliance meetings and to have tobacco control on their agendas, it's also, I felt, important for me to be part of what they are doing and actually attend the annual health summits and contribute to that as well. And it's all part of that increased visibility. By doing that, you are also not only supporting your partners and colleagues in the areas that are important to them, but also making sure that tobacco control and smoking cessation, there's that visibility, and it's always on the agenda as well. The joining forces, really, it was more regarding the city-county sort of joint strategic alliance approach that we're looking to do. And I think we both, Leicester City and ourselves have very similar agendas, similar tobacco control priorities. So it makes sense for us to be doing this together, working together. And I think it just makes for a stronger alliance, really, again. So forging partnerships, once we've obviously had our main priorities, we set up the Tobacco Control Alliance, making sure that what I felt the priorities were aligned to what the health leads felt their priorities were. And I know, again, Vicky mentioned senior level buy-in and the importance of that. I can't stress how important it is. I think it really is helpful not only to have your Director of Public Health on board, but in Leicestershire, we have the chair of the Health Leads Partnerships Board, who also has this buy-in in terms of tobacco control, and it's having that sort of senior level buy-in all the way down through to operational level, really, and that's again is really important. But it's also about the shared responsibility and ownership. You know, we all have priorities around tobacco control. It's not just my sort of priority and responsibility as a lead, but it's for everyone who attends the alliance and contributes to it. We all have a shared responsibility and ownership in improving the health and well-being of the populations that we serve. So we've got the Tobacco Control Action Plan in place. We've done that jointly, made sure that whatever's on there, they were happy with. And the same with the terms of reference as well, making sure, you know, I drew it up, making sure that they were happy with that as well. And so I suppose the results so far, we meet on a quarterly basis, and in terms of our priorities and the action plan, it's steaming ahead. You know, a lot of our objectives we are meeting, and that can only be because of the collaborative approach, but also you know, it's making sure that it's a consistent approach, meeting quarterly, speaking, communicating, really important. Just it allows for consistent messages, really. But also with partnership working comes a wealth of resource in terms of their contacts. It's tapping into their contacts as well at a grassroots level, and taking your agenda forward. The collaborative action adds value to what we're trying to achieve. It's allows for increased capacity, you know, and doing it together. More heads are better than one, really. Involves officers at a strategic level as well as an operational level. That again is really important. And once more, I've said shared ownership and responsibility. They're as much as responsible for the progress of tobacco control as I am as the lead. So that's sort of where we're at in terms of Leicestershire. And I think that's me done. So if there's any questions, please feel free to send them in.
Thank you, Zaheera. That was really interesting to hear. We have an opportunity for a couple of questions, and I've got a couple of questions that have come in, so I will ask those now. So one was, you had on there, Zaheera, around a salesperson. And I guess the question here was that kind of, what do you mean about that? And how, you know, in using that, how did you engage all that district councils? So you've got quite a complex area in terms of district councils. How did you get them all round the table?
Right. So it's like when I say salesperson, it's like, you know, when you're cold calling, because obviously they don't know me, I'm new. They've not had the best experiences with probably previous providers in terms of smoking cessation, and that there was a lack of communication. So it really felt like I needed to go and sell the priorities in terms of what it is I'm trying to achieve, but you know, how is what I'm trying to achieve going to benefit district council and the populations that they serve. So it's looking at what do we have in common, you know, what are our priorities and how are we going to get there. Getting them round the table, it was literally like picking up the phone, speaking to them, and then saying, look, this is what I'm trying to arrange. What do you think? Can we get round the table? Can we discuss? And that's exactly what I did, really, is literally call them up, or when you see them at meetings, go to them and say, look, this is what I'm trying to do. Would you be willing to come along to this meeting, and let's discuss and look at how we're going to rebuild this alliance and take it forward. And that's basically what I did.
Thank you. And this last question, we've just got time for one question, which was, we've had a few questions in around the kind of communication and marketing side of things. We've heard from Vicky around the reduction in kind of mass media and marketing across England, and you mentioned there around comms packs for districts that you used. Could you give us a little bit more information on what they were? What did they include?
Yeah, sure. So, for example, I mean, to be fair, being part of such a huge local authority, we do have a communications team that lends support to us in public health. So it was, using the comms team. So whenever we do any sort of national campaigns around Stoptober, for example, I would put together things like posters, leaflets, information, some that were very based, or developed due to local needs, so very tailored to our local sort of areas. Put those together, have things like the digital banners that would be tweeted out, put all of that together with the help of the comms team, and we would literally send that as a Marcoms pack electronically to the district councils. And of course, if they needed any hard copies of things like posters and that, we would make sure that that's all available to them as and when they need it. Does that answer the question?
It does. Thank you very much for those. There are other questions, but what we'll do is, if we can't answer those questions, we'll bring them onto the next Q&A, and if we don't get to answer those, then we will write out and do a bit of a Q&A sheet that we sent out for. So thank you, Zaheera, for that. Next, we have Kerry Riley from Blackburn and Darwen Council. This is an interesting one because Kerry has reinvigorated her Tobacco Control Alliance activity, and we're going to learn how she's brought the partners back around the table and created an alliance partnership.
Hi, thank you. Yes, my name's Kerry Riley. I'm a Public Health Development Manager here at Blackburn with Darwen Council. I started in post in September last year, so this work is relatively new. I'll just move the screen on. Okay, so Blackburn with Darwen has approximately 250 smoking attributable deaths each year, and it is actually the worst quintile for 8 out of the 9 mortality indicators in Public Health England's local tobacco control profile. We have a really high smoking prevalence here, and the cost is estimated by ASH to be 34.2 million to us here. So, with that in mind, we really needed to tackle the smoking prevalence and get that down for the benefit of our population, but also financially as well. Public Health England has calculated that Blackburn with Darwen is in the highest quintile for the cost per head of smoking attributable hospital admissions and our high childhood asthma rates as well. So we were off the boil with tobacco here in Blackburn, and we really needed to get the agenda back going when I started. So how did we go about doing that? Due to this drift, we felt that we needed to pull an alliance together to get a multi-agency approach to reducing smoking prevalence. And we wanted to be able to share information, share the learning together from different organisations, and contribute together to a local clear assessment, which would help us then set priorities for the future. Finally, we felt that the alliance would allow us to review performance, review the public health profiles and review performance locally to work together in reviewing those and setting priorities for the future. An example of that is in recently we have a local trading standards young persons attitude survey, and the uptake previously has been really poor, but since we've pulled the alliance together and identified that as a group, we're now utilising the skills of our school nursing teams to work with our trading standards department to hopefully get a better uptake this year, and then we can use that data to help drive initiatives forward and do some further planning around that. So that's one good example already of what having an alliance has achieved. It's looking at that broader area of tobacco control that we had been missing previously. So what did we find useful in setting up our alliance? Initially, it was that clear assessment tool, because without that, we wouldn't have been able to get all the stakeholders around the table and rethinking about tobacco. So, you know, like putting it back on the agenda. So the clear assessment allowed us to focus on those broader issues and look at how we together are going to reduce smoking prevalence. We held 2 events, and Public Health England facilitated the scoring and action planning for those sessions for us. And as I said, this was absolutely critical in us in engaging local partners onto an alliance. And it gave us that platform, that action plan of what the alliance needed to focus on initially. So for me, that was real key in getting the alliance up and running. Further tools that we used were ASH website and the resources that were on there. So with the great, you've got great letters that invited wider partners to the Tobacco Alliance. So we've got a consultant that sits on from our local health providers, and we was able to invite them and really invest in those coming. We used the ASH resources to draft the terms of reference, and we just found that really, really useful. So locally, our local Tobacco Alliance group provides now a structure to support strategic decision making around tobacco and reducing prevalence. It's driving forward key priorities, and it's offering evidence and credibility to that voice of tobacco control within Blackburn with Darwen. And we've now got a collaborative approach. We have many stakeholders that sit on our alliance. I'll give you a couple of examples. We've got both NHS providers. We've got Lancashire Care Foundation Trust, East Lancs Hospital Trust. So we have midwives, senior midwives, health visitors, school nurses, consultants. We have the CCG commissioners. We have the local hospital Stop Smoking wellbeing service team that sit there, comms, trading standards. If I just move on, we have a really engaged elected member as well, who is helping to really drive forward that strategic governance and feed into the Health and Wellbeing Board. And also our local Tobacco Alliance with our elected member now feeds into the primary care neighbourhoods that are up and running locally. So we've really, from having the clear assessment, from reinvigorating the local Tobacco Alliance and getting all these providers on board, we've really put tobacco back on multiple agendas, and right through the ICS down to those primary care neighbourhoods. Locally in Blackburn with Darwen, we do have a Tobacco Free Lancashire group and the Smoking in Pregnancy meetings. So we meet twice across Pan Lancashire. So we're able to feed through our local area priorities and actions and what we're doing into that wider vision as well, and obviously that runs back through both ways. So for us, I mean, it is, like I said, early days. I've only been in post in September, but we were already seeing that tobacco is now back on many levels, and the alliance is really well attended. So hopefully we can continue and keep going from strength to strength. So thank you for listening, and I'll take any questions.
Okay, thank you, Kerry. That was really, really inspiring, and it's you can hear the passion in your voice, so it's really good to hear that. We will just hold back on questions for a moment. We've got Kaye coming in now, so it's Kaye's going to be our final case study from Barnsley Council. Kaye participated in the Yorkshire and the Humber workshop, and she's going to talk to us about how senior leadership and that comprehensive approach are the keys to success in the Tobacco Alliance.
Thank you, Scott. Hello, everybody. So my name's Kaye, as Scott said, and I lead on tobacco control for Barnsley. So I'm just going to take you through our Barnsley Tobacco Control Alliance, which is an example of a traditional alliance model, really. If you're not familiar with Barnsley, we're an ex-mining town in South Yorkshire, with the 39th most deprived local authority in England, and its adult smoking prevalence at the minute is 18.2%. We're a metropolitan borough council, and it's quite easy here because we've got one CCG and one acute trust, thankfully. So for us, as political leadership has been crucial. So tobacco is a priority in Barnsley. It's a priority for us Health and Wellbeing Board. It's a priority in our public health strategy. And we're very lucky to have our Tobacco Alliance chaired by the Deputy Leader of the Council, so Councillor Jim Andrews. He is the Cabinet spokesperson for public health, which has made it easier to get him to do that, but is really behind all the work we do, which helps then, because when he goes in his other meetings, he can then raise tobacco in his other meetings and forums. We've got a very simple, easy vision in Barnsley. So his vision is to make smoking invisible. So this 3-word strapline is used on all our work, and so far people like it and they can remember it. It's simple and they just get it. So rather than making it about the smokers, we make it about the children and young people. We want to protect them from the harms of smoking and help them stop taking up smoking. Obviously, we want to help the smokers to quit as well, but for us, we find that nobody can argue with wanting to help children, and it's really helped get more people on board. For us as well, the regional support has been vital, so thank you to Scott for all the work he does, and the Breathe 2025 campaign has been really useful for us. It's a really good resource. We refer people to the website, we use the resources on the website, the videos, and we've just got that shared vision across the region. We all know about it, we all work towards the same vision, so it's been really useful. We also make sure we attend the quarterly regional meetings that Scott chairs, and that's really good to find out what's happening regionally and nationally from Scott, and also to share good practice with our local area and to network with those colleagues. What we do find vital as well is Scott attending our local Tobacco Alliance in Barnsley. He attends, gives an update at each meeting, and also makes sure what we're doing is the best practice, really. And he's always on end of a phone or an email, so we're always emailing him saying, Scott, what does the evidence say about this? Or Scott, what are other areas doing on this? And he's always got the answer, so that's been great for us. We make tobacco control everyone's business in Barnsley, as the previous presentations have said similar things. So smoking cessation is obviously a big part of our tobacco control, and we've got an excellent stop smoking service in Barnsley with a 65% quit rate, which is really great, but that's just one of the parts of the bigger picture for us. So we have as many people involved in the alliance as we can, basically. So as I mentioned, we've got elected members what sit on it. So we've not only got Councillor Andrews who chairs it, we also have two or three other elected members what physically sit at the meetings and take away any actions if they need to, and sing our praises in their other meetings. They're all very passionate and supportive. And we just basically invite any elected members, if they show an interest in tobacco, would you like to be part of our Tobacco Alliance? Even if they don't attend the meetings, we keep them on the distribution list so they get the updates, etc. Obviously, we've got public health, regulatory services to do our tobacco enforcement. We also have different colleagues from across the council sat on our Tobacco Alliance, so people who are linked to the bins and waste, the markets, social care, etc. The hospital are key players on a Tobacco Alliance, as are obviously the CCG and the fire service. We always make sure we've got a comms lead attending the meetings, and they take away the comms actions straight away and action those. We also get education representatives, so primary, secondary and college. We've been doing a lot of work within those settings as well. And obviously Scott is a key player in our alliance. In Barnsley, we do like to be innovative, and we don't just follow, we like to be the first to do things. It doesn't stop us from trying it if nobody else has tried it. So an example being our smoke-free markets, which we did get some negative press and legal challenge about. So we have banned the sale of any cigarette-related items from any of our markets. But thanks to our strong political backing, we stuck to our guns, and it was a success, and it's so far working. We also get a few mentions of Forest, the pro-smoking group. They've blogged and tweeted us about a few times about us, but we see this as a mark of success, really. If we're on their radar, then they know that what we're doing is helping to reduce smoking, so bring it on. We're also good at showing off in Barnsley, so if we do something good, we shout about it. So not just locally within Barnsley to us elected members, etc., but also through the local media, regional media. So as Make Smoking Invisible, we have a launch for each smoke-free area, what we do, and we invite as many press as we can to that. So for example, our Smoke-Free Schools launch, we got on Look North, Calendar, etc., local radio, but we also managed to get CBBC Newsround to come and film it, and it was great for obviously Barnsley, but also brilliant for the children who took part, so they could see themselves on telly. And also elected members love success stories and high profile work, so the bigger the better for them, so it helps us to engage those. Just very briefly about the meetings itself, we hold 2-hour meetings quarterly. We try and make it interactive, driven by all those around the table. We don't performance manage, it's more of a partnership, and we work together on what we need to improve on. We structure the meeting agenda around the national strategy themes to keep it consistent every meeting. And we never cancel. We never had a problem with low numbers, but if we were, we still wouldn't cancel, just to keep that consistency. And we also follow up in between meetings. Obviously, they're only every quarterly, but there's a lot of work what goes off in between. And we don't get complacent. We're always reviewing and adapting to make sure everybody's happy and it's working. And those are my details. If anybody's got any more questions or wants any information from Barnsley, please don't hesitate to contact me.
Thank you, Kaye. It's a good job that people can't see me because I went a little bit flustered and red there. Thank you, Kaye, for that. We've got time for a few questions. So really excellent presentations. Thank you for everyone that's presented there. We've got a few questions coming in then. Oh, there's some more coming in. Right, first one, which is probably to both Kaye and Kerry. This is a question to say that an area has done their clear, which they found really useful, and it did engage people, but when they're not a part of that clear anymore, their kind of commitment seems to fade. How do you sort of maintain that engagement with all your partners across? And I suppose from like many tobacco control leads, how do you kind of share the workload and make sure that everybody's involved and it's not just you that are driving things forward? So perhaps Kerry first.
Yes. So yeah, I mean I think not having an alliance for so long and tobacco drifting on the agenda, a lot of people were keen because they wanted to do something as well. So a lot of departments had that already, that desire to become involved. So I think by someone coming in and reinvigorating it, they was as passionate to be involved as well. But sorry, what was the end of the question?
It was about how do you maintain everybody being
Yeah,
involved,
being
not just you.
involved. So so they were already invested and came along. But we have a great counsellor who chairs our meetings, and she is really passionate as well. And she feeds that through and encourages everyone to take a role in chairing and maybe presenting at our meeting. So it's literally just from dripping that message and from including everybody and being clear in our objectives and where we're going that has kept everyone on board and able to come. And even if they can't attend, like Kaye said, then we do keep them on the distribution list so that they can email in or they know that we're there. And as we're quite new, we have to keep dripping that message and making sure that wider partners are aware that we're still there. And then when they want anything, they'll come to us, won't they? So it's just about the communication, really. And that's how we've done it here.
Thank you. There is a question around. Actually, Kaye, do you want to come in back on that last question?
Yeah.
I know that you do a lot, but how do you keep your partners involved in so that they're actually doing the doing as well?
Yeah, I suppose that is an issue because you do end up doing a lot yourself. So you've got to keep reminding yourself that it's not just you, it's the Tobacco Alliance what owns the action plan. But we're quite good at selling it to different partners why they should be involved. So we tailor it to them. So, for example, the hospital, it's about readmissions. If you're working with different departments in the council, it's about, you might be talking about bins and litter and why they should help us and what they'll get out of it as well themselves. So, as Zaheera says, you're like salesmen of tobacco control and what they're going to get out of it, as well as working towards a shared goal across the borough. And it's also about sharing the results. When we do see a big drop in the prevalence, we shout about it and look what we've done all together. We've worked together to achieve this as well. So it's that communication, selling it to them, etc.
Okay, Kaye, and another question for you, Kaye. Councillor Andrew is obviously a clear leader at Barnsley. How did you manage to get him on board?
Yeah, it does help that he's the portfolio holder for public health, so he has to be interested in public health. But basically, it's just ask him. They can only say no if they don't want to, so we just ask them very nicely and like obviously put it to them why we want him and sell it to them, and they're willing to take part if you just ask. If you don't ask, you don't know. But that's all I'd say. We just ask very nicely, and if they say no, then we'll ask somebody else.
Thank you. A question for Kerry around pan-regional working. Do you do some work with smoking in pregnancy, and how does that add value to your alliance?
We do, yes. We're part of a pan-Lancashire smoking in pregnancy group that's chaired by one of the consultants in public health from Blackpool. So we attend those, and recently we've done a baby clear assessment on a pan Lancashire level that was facilitated by the local maternity system. So we're all contributing to that action plan, and having the alliance has been really helpful because we are part of Pan Lancashire, but we are a unitary authority. So we've been able to take our actions from the Pan Lancashire baby clear assessment and start to put them into action locally within Blackburn with Darwen and then feedback. So it's been really productive in having and useful in having that local alliance here that we can feed through to Pan Lancashire and back. It's been really helpful.
And a question off the back of that, I guess. This is a question, in areas that don't have regional structures, like a Breathe or a Fresh or a Greater Manchester, how did you manage to do that? How did you manage to pull that smoking pregnancy group together? And could you do that? How do you think we can pull areas together and tobacco leads together that don't have that regional structure?
That's a really good question, and I'm not sure I'm able to answer that because it was already up and running when I started. Yeah. It's been well embedded for many years here. So I'm probably not able to answer that one. It was when I started, that was one of the meetings that you attended. So the Alliance came second, really, off the back of it. So sorry.
That is fine. Despite budget cuts and pressures over the last few years, how have you kept partners coming along to your alliance?
Just purely through need and asking them, like Kaye said, selling yourself and offering favours in return for them coming. It's that about having that relationship with different partners, and because I work across multiple areas as well within public health, you build up those connections with other people in other departments and just keep dripping smoking and why we need to do it, because it does cross over multiple areas, like Kaye said, selling it about the hospital admissions and the asthma to the school nurses who are supporting schools. So really making them believe and understand that it's in their best interest to attend. It's in all our interest to work together. Budgets has been has a big impact on us all, doesn't it? And we don't have a stop smoking service here in Blackburn. We deliver all our smoking cessation services through our pharmacists. So with that in mind, we have the local Lancashire pharmacy lead that also sits on the alliance. So it's just really through selling it and negotiating and not putting too much on, expecting them to come every week. We do ours quarterly, which I found really helpful. Hope that answers the question.
Thank you. Just time for one last question before we move on to our final speaker, Lisa. So this is a question that obviously communications has come up quite a lot, both nationally and locally and regionally. So both of you have got comms colleagues sat on your alliance and attending the meetings. How did you persuade your comms colleagues to come and support that? I guess, Kaye, you mentioned quite a few things around media and even CBBS and news round. How did you get your comms involved in helping you with that?
Again, just invite them and ask them to do the work. But as I said, it's a priority in Barnsley, so it's a public health priority, and we've got a comms public health link person within the communications team. So it's just one of the key things on her work plan, basically. But she's really good. Any comms actions that come from each meeting, she actions straight away, and we can ask her ad hoc for things. We'll look at what we've got in Barnsley. She has got the capacity to do that as well. So yeah.
Yeah, we're very similar here in Blackburn. We also have a public health comms representative for the team, and again, it's the same. It's one of our strategic objectives. So we're very lucky that it comes from that level, really.
Thank you both. Very interesting presentations. Thank you very much. So our final speaker is Lisa Surtees from Fresh. Lisa is going to give us a quick overview of the current thinking about a new resource to support local alliances at work and how you can get involved yourselves to help create that resource that would be really useful for all our tobacco leads.
Thank you, Scott, and thank you to our speakers so far on the webinar. Really good to hear from our case studies in the range of activity locally. So as Scott says, I'm Lisa Surtees. I'm the Business and Operations Manager working with Fresh. I've worked with Fresh since 2005, and we are delighted to be working in partnership with ASH on this project around effective local tobacco control delivery. So in this part of the webinar, I will be summarising the key resources currently used by partners, providing some examples, building on what we've already heard today, any gaps that were identified during the workshops and our partners' discussions, and looking at the concept of a new resource, a tobacco control roadmap. And we'll finish with some next steps following the webinar. So examples of current tools used locally. There were a range of resources that were referenced during the workshop. We've used here today an example of the list that was cited the most. So all of these resources were references helping to engage partners and to drive interest in the tobacco control agenda. The ASH web-based resources, as we've already heard today from some of our case studies, are widely recognised and really valued. A lot of the things that were noted were the things such as tobacco control, what is tobacco control in the evidence base. You know, this is really crucial for partners that are coming on board who are new to tobacco control as an agenda, who are not quite sure the breadth of this and what the correct evidence base is to be quoting to partners. Briefings for different stakeholders and how you tailor that message around how you make the case for tobacco to your audiences is really important. A comprehensive document is available from ASH on how to set up an alliance, and we heard from Kerry there about how she used some of that in terms of creating a structure for an alliance, in terms of reference, and thinking about strategy and action planning. So it's great to know that these resources are still valued and that they are still there for everyone to be able to use via the ASH website. The ASH Ready Reckoner, again, this is something that is regularly cited all of the time around trying to get forward, you know, the costs of smoking. And this is used in a range of different ways, whether it's a paper to Health and Wellbeing Board, whether it's in local PR to say what the cost of smoking is, or whether it's to engage those partners around the table to say this is why you need to be involved, this is why it's important to you. The PHE Clear tool, this is really well used, and I think it's excellent that it can help to take stock on tobacco control delivery. It can help to reinvigorate local delivery and engage new partners, and it can be used at any part of the journey where you are on tobacco control. So those areas that already had alliances set up with action plans and strategies, they actually can use the assessment to think about, you know, the performance and where to move forward and what some of those recommendations are. There were people as well that had also done the peer assessment where you invite a team in to look more in depth at your findings and to come up with some of the recommendations. So it's great to see that after this time it is still a really valued tool, and it is something you would encourage localities to be looking at. Alongside that, with PHE tools, the smoke-free website and the marketing resources, particularly around support and campaign activity, was well cited with localities for campaigns such as Stoptober and the Health Harms campaign for tobacco. The Fresh brand logo and also Breathe 2025, as we've already heard from one of our case studies, you know, it can have that real strength in having that overarching brand and logo for localities to be able to amplify that message that is happening at that population level. And this certainly came through in the workshops in the North East and in the Yorkshire and the Humber, that being able to adopt that local brand and support that overarching vision can give you a lot bigger voice in being able to get your messages out there in very recognisable in terms of tangible things that you're trying to achieve around tobacco control. The local government declaration, really good for engaging councillors, you know, councillors who are leading on health portfolio, the leaders of the council, even at the chief exec level when you're signing off the declaration. So this can be great to get that on the council agenda for tobacco control, and it was certainly cited as a particularly good resource for district level, which came out in some of the workshops as well. So new data and reports. So this again is something that local partners value. It's a reason to contact and engage partners, especially when issues and things like data can be broken down at that local level. So thinking about prevalence or thinking about public opinion, these are all really good tools to have in our box when we're looking at tobacco control. Guidance to inform local work programmes, pathways such as NICE is really helpful as well. So moving on now to think about, what are the gaps there? And, the feedback suggests that there is a reasonable level of awareness of the broad range of resources available, and some are more prominent than others. It seems to be the key challenge is actually keeping track of new resources and where to find them. And some local partners did report, having different ways of how these are cascaded, actually alerting localities when this is due to happen, and then a follow-up around how to actually use any new resource or guidance would be really welcomed. So what we could think about when we were looking at this is not necessarily a gap around a tool or a resource to help you deliver effective local tobacco control, but more about actually having a resource that puts everything in one place for localities to access and for them to easily identify what is relevant to them. Because if you're new to tobacco control, it can be quite overwhelming and it can be difficult to pinpoint the latest tools to support you and how you sign up for these updates. So one of the potential solutions that we were considering is a tobacco control roadmap. So I'm going to show you on the next slide is an example of a recently published roadmap by the government for health education. And we were wondering whether this could be something that could be used for tobacco control. So the roadmap for the health education, as you can see, and I will show you on the PDF hopefully after I've just talked through a couple of points, that it is interactive, but it's ideal because you can see in a snapshot basically on a roadmap where you are in terms of the tobacco control journey. So you can hone in straight away and think about, okay, what resources are there for me at this stage of my journey? It's an opportunity to signpost partners to both new and existing resources on tobacco control. And really importantly, I feel, is that it's an opportunity to emphasise the international evidence base that exists for broader tobacco control, which is so important. So it's not just about stop smoking service and support. It's a multifaceted approach, and we're so fortunate in tobacco control that we've got this breadth of evidence that we can draw upon at every part of our delivery for tobacco control. So this is something that would be really useful for us to be able to look at. So I'm going to try and just open up the actual PDF so you can see that where you can actually just hover over things. So ideally, we would think about what that model would potentially look like for tobacco control. So you can start at the beginning of your journey when you're thinking about setting up and making the case, about how you look at the leadership around it. If you're setting up an alliance, looking at your policies. And I can really see how this could work for us, and it could answer and fill some of those gaps that you've identified locally about where you need to have that support going forward. So the next steps are we will be forming a small task and finish group to try and take forward the feedback from the webinar today and also to help shape a potential roadmap for tobacco control. Ideally, we want this to be an ongoing conversation with you locally as partners who would be using the end product. So we would like to have representation on the task and finish group from a representative from each of the regions, and we would like this to reflect different stages of the journey. So if you are just new to tobacco control, if you're trying to reinvigorate your alliance, if you've actually got a very well-established structure, because we want actually for this to be useful for everybody, and we want something that is going to tick that box and really support you. What work will be involved? Well, we anticipate that there will be 2 conference call meetings to take place between July and September to try and help shape this resource and get together the model and what it will look like and how it will function. The new resource will ideally be published by December 2019. So all I can kind of say to you is if you want to get involved, we're so grateful so far for how great all of your feedback has been and your engagement on this around your delivery today. So if you do want to get involved, then you can email an expression of interest to Vicky at Ash, and then we'll follow up on the next steps depending on how much interest we get in. So that is the end of my presentation. Thank you very much, and I hope you found this useful. And I'll hand back over to our chair, Scott.
Thank you, Lisa. Some really interesting ideas, and I too just want to highlight that it would be really good to get people and reps from across England involved to make it as useful for local tobacco leads as possible. So this brings us to the close of the webinar. And I just want to again take this opportunity to thank you for all dialing in. Thank you for the important role that you're playing in reducing smoking prevalence, and keep up the good work. Thank you.